Y'all excuse my cloudfish scrub top. We had clinic today, and the kids there call this my Finding Nemo shirt. So anyway, came straight from work to here. I really appreciate Chrissy giving us the opportunity to share with you about the Commission for Children. The Commission for Children with Special Health Care Needs is a state agency in Kentucky that serves children from birth to age 21 in the state of Kentucky. We've been around for a long time, since 1924. Our early focus back in the 20s and 30s was children with polio and taking care of them. Our focus has changed as the needs have changed. We joke that we're the best kept secret in the state of Kentucky because a lot of times people haven't heard of us. The Commission for Children has several offices across the state. The office here in Paducah covers all of the western
10, actually.
Western Kentucky counties. And currently the clinics that we have in the Paducah office are cardiology. We work with pediatric cardiology, or ULP, pediatric cardiology from Louisville. Neurology, which is ULP child neurology, of which Dr. Barnes is a partner. We work with Sean Jones from Purchase ENT, comes over and does otology clinics. Dr. Mark Crawford does a scoliosis clinic. We also have a vision clinic for children with more severe vision issues with Dr. Jeff Johnson. And we have a full-time audiologist in our office, Kelly Coker. She does hearing evaluations, and we also have a full-time social worker, 3 nurses, of which I'm one. My role is as a nurse care coordinator. I'm the charge nurse over the neurology clinic. I currently have a caseload of about 90 children. Some are adults because we go through age 21. And I'm also the intake nurse. So if someone is calling to get a referral for a clinic service, or a parent has concerns or questions about a clinic service, I'm the person that takes that phone call. I'm very excited that there's been discussion about autism services in West Kentucky, because I will tell you, for me, that is the #1 thing that I feel sometimes I can't help a family with. The Commission for Children has eligible diagnoses, and we do see children who have autism in our neurology clinic and other clinics, but the reason they're coming in our door is for a seizure disorder, a brain anomaly, tics, Tourette's, headaches, ataxias, different other types of diagnoses. They have autism, so while they're there, that's addressed. But if I have a phone call of someone saying, I have a child who's on the spectrum, can I get services? At this point in time, it's not an eligible diagnosis, but we're hoping that's going to change in the future.
Yeah, that is going to change.
So I am very excited about that, very excited about that. So our clinic services, if you were to come on a clinic day, it would look a lot like a doctor's office. You would have a nurse who would assess, do a height and a weight, ask questions about current medications. So today was a clinic day, so it looked very much like a doctor's office. That going forward, we provide care coordination on those times where we're not at clinic. So if I have a family who comes in today and based on their visit, an MRI needs to be ordered, or a referral needs to be made for another specialist, they need assistance with gas or lodging to get to a trip, and so forth and so on. I want to think of myself as an extra pair of helping hands. Sometimes when we have children with special health care needs, they have multiple organ system involvement, and it is so overwhelming for families. You know, I had a mom today who said she's seeing 7 specialists right now for her child. So I want to come alongside a family and help them. Just, here's a reminder, you've got this appointment. How did that appointment go? Do you know you're supposed to follow up in 3 months? So we do ongoing case management, care coordination as well, okay? So that's kind of how the Commission for Children works. If you apply at the Commission for Children, at this time, anyone can call and ask for an application, other than in neurology, because we had such a backup on neurology and a waiting list. If your child doesn't have a known diagnosis, if you call me and you say, Belinda, my child has seizures and they're on Depakote, I will go ahead and send you an application. But if you're not sure if they have seizures, I'm going to ask that your primary care provider give us a call and give us the referral, okay? When a family comes into the commission, their fee is based on a sliding scale, which is based on family size and income. I will let you know that if you have a medical card, you will be placed in a 0% pay category. The majority of our families probably have a medical card, but we also have families who have no insurance, and although that's going to be less and less since the Affordable Health Care Act came in. And we also have families who have private insurance. They still want to come to us because, for example, if you can come see a pediatric neurologist in Paducah, Kentucky, guess where you don't have to drive to?
Nashville.
Louisville, Nashville, or St. Louis. I promise you, every year I canvass this area, there is not a practicing pediatric neurologist in West Kentucky. Nowhere, okay? And so it is definitely a need, and so I'm very thankful that we have providers from Louisville who come to our office and do our clinic. So I'm kind of tooting a horn about neurology because that's the area I work in. But as you can see from the brochure, there are other clinics. Now, let's take, for example, your child needs to see an orthopedic doctor. We do not have an orthopedic clinic right now in Paducah, but we do have a pediatric orthopedic physician, Dr. Laura Jacks, who is going to our Owensboro office, and a commission clinic is held there. So if we don't have the clinic you need, we will try to get you connected with an office who does. The offices in West Kentucky are Paducah, Owensboro, Bowling Green, Elizabethtown, and I consider Louisville as well. And then we have offices on the eastern part of the state. The benefit to you if you came through the commission versus seeing the physician privately, because you can do that, is that you would have the benefit of care coordination from a registered nurse within the office. You also, that if you're enrolled in the commission for children, we can, like I mentioned before, we can help you maybe if you had problems with gas cost and transportation. That's just another benefit we can do. We help get rooms at Ronald McDonald House, or if that's not available, we will even help get a family get a room in a hotel if they are in a 0% pay category. And I'm talking really fast, so are there any questions? Yes, ma'am.
So in the event that something comes up, because I had something recently, but you take your child to a pediatrician and they can't get into a pediatric neurologist anytime soon, you all have the resources to be able to make that happen quicker, more efficiently?
It depends on when my clinics are scheduled. For example, I have clinics 6 times a year. My last clinic is in November. The next one for 2015 will probably be in March. If I get that application in early December, there's a wait. But for example, right now, every new patient that I've gotten was either in my clinic today or will be in my clinic in August, because I have room for them now. And the reason I have room for them, I'm glad you asked, we've also started a clinic called telemedicine or telehealth with a neurology clinic. We've only been doing it about 9 months in the Paducah office. And this is where not a new child, not a new patient, and a child who's relatively stable, we will have closed circuit television with the nurse practitioner or Dr. Puri in their office in Louisville. We're here in our office in Paducah. We see each other over a large screen TV or a computer monitor, and the nurse, myself, would perform the assessment. The family is still talking and doing that interview. The chart is faxed to the office, so they're reviewing medical records. So because we've started that, I now have more open spaces for new patients in my other clinics.
And she will have even more openings in the neurology clinic when we transfer all of the autism kids over to the autism clinic here. So she'll actually have even more space for children who aren't on the spectrum to be able to be seen in those clinics.
Is there an age cutoff?
Births to 21.
For everybody else except for the autism patients.
Okay.
The plan actually for the autism patients and the commission is actually to span across the lifespan. That's our plan. Now, we're obviously gonna start with pediatrics, but
Right, and that's why I asked, I had comparing pediatricians.
Let me correct something. We do also have hemophilia, and that goes past the age of 21.
yeah.
So let me correct that. But that's not in the Paducah office.
But it sounds like you're working on the way to getting more neurology services and things here, so that we don't have to go to Louisville, Nashville,
Or
places.
Bowling Green.
Dr. Barnes.
I'm in
I'm
Bowling Green.
sorry.
I'm in Bowling Green and in Owensboro.
And Dr. Barnes will really elaborate on that a little more whenever he comes out, like what he's going to say is going to be great stuff.
Prior to ULP Child Neurology coming and contracting to do a clinic with the Commission for Children, we had 2 general neurologists who were just willing to come and see children. But if a child was very involved, they would refer them to a pediatric neurologist. And we lost that clinic for almost a year. We didn't have a neurology clinic at all. And then the staff at ULP Child Neurology agreed to start traveling here. And so, for example, they're up at 3 or 4 in the morning to hit the road to drive to Paducah, see patients all day long, and then they drive back in the same day.
I do EEGs at the other hospital, and we used to do children, and now we can't do them under a certain age because we don't have a pediatric neurologist to read them.
Most of the hospitals in this area are supposed to be contracted with Dr. Puri to read EEGs.
Right, it would
pediatric
have to be
EEGs.
go through a computer system, and it's a whole big one.
I schedule EEGs locally where I'm
We can
not
talk
able
about
to.
it.
Where I'm not able to is if it requires sedation. That's where the
Right, we don't
hospitals
do
have
that
told me
any
they
longer
won't,
either.
because he's not on staff at that hospital.
Right,
Correct.
right.
So we,
And that
but
makes
if they're
perfect
that
sense.
involved, we
Any
usually
other
send them
ED
to
treatment, we should
post
be able to
anyway.
read.
That would be easier than having to send